Our next topic is the most common, very basic, but the most important in nursing career. It's all about vital signs and physical assessment, the basic functions of life. This is prepared to you by ExamWise. Vital signs includes measuring temperature, pulse rate, respiratory rate, blood pressure, oxygen saturation, pain, and you have things to consider such as urine output and level of consciousness as part of your vital signs. Temperature. Temperature can be taken orally through an oral thermometer, axillary or through the armpit through an axillary thermometer. I don't know if that exists now, but there is a mercuric temperature that can measure axillary temperature. Tympanic through the ears, or anal or rectal temperature. The normal. The normal temperature is 36.5 degrees Celsius to 37.5 degrees Celsius, and the average is 37 degrees Celsius. This applies to all ages. As you can see in the picture, the average normal range is from 36.5 to 38, and that means when a patient's temperature is more than 38 degrees Celsius, it is called pyrexia or hyperthermia, and when it reaches to above 40 degrees Celsius, that is very crucial and it can lead to death. While on the other hand, if the temperature is on 36 below, it is called hypothermia. There are several factors that can affect the reading of your temperature. First thing is illness and infections, even those that do not produce a fever. Sometimes illness can cause you to be hypothermic. Drugs and medications. Alcohol, especially in large quantities, though all alcohol consumption should be recorded. Smoking. If you smoke, you should consider quitting before you are even pregnant. Physical and emotional stress can raise your temperature. Excitement. Sleep disturbances such as insomnia, night waking, upsetting dreams, or poor sleep can lower or raise your temperature. Change in waking times, climate, travel, and jet lag. Change of room temperature. Fertility and recently discontinued birth control pills. These hormones, especially the female hormones, can affect rise and fall of temperatures. And breastfeeding. Let's go to pulse rate. Pulse rate can be taken in different sites and should be taken in 1 full minute. Use the pointer and middle finger when feeling for the pulses, not the thumb, because if you use your thumb, there is your arterial pulse in there, and which can cause a false positive result. In this picture, you can see the different pulse sites, that is the temporal, the carotid, apical, brachial, femoral, radial, popliteal, and pedial. In most cases, and in normal cases, we always use the radial pulse rate. However, if there is a poor circulation, the best pulse rate could be the femoral or the carotid pulse. The normal. Here is a table that shows age in year and the normal range beats per minute. There are different factors that can affect your pulse rate. Illness, emotional stress, exercise, breathing, medications, body temperature, glycogen or glucose levels, cardiovascular diseases, dehydration, respiratory rate. Respiratory rate should be taken in 1 full minute by looking at the inspiration and expiration. If not visible, touching the chest and feeling for respirations can help. The normal. Here is a table, age in year, and to the normal range, cycles per minute. There are certain factors that also affect your respiration. Temperature, levels of carbon dioxide in the body, heart function, drugs, activity, blood pressure. There are several ways in taking the blood pressure, and the most common is a brachial artery. Position limb at level of heart and place cuff on upper arm and auscultate brachial artery. This is what I'm talking about, the brachial artery, where you position your cuff at the upper arm and you do auscultate here at the brachial artery. However, there are times that you cannot do at the brachial artery. Conditions such as DVT or deep vein thrombosis or lumpectomy, where they're taking the lump and the lymph nodes out, and lymph edema, you cannot take at the brachial artery. So most of the nurses take it through the radial artery. If you can see this pointer, the radial artery. Position limb at level of heart. Place cuff above the wrist. Auscultate radial artery. There are times when you can't do on the upper limbs and you have to go further down to the lower limbs. So there is the dorsalis pedis artery and the posterior tibial artery. Place cuff above malleoli or at mid-calf. Auscultate either the posterior tibial artery or the dorsalis pedis artery. You can also go further up at the popliteal artery. Place cuff above the knee. Auscultate the popliteal artery. The normal. You can see in this table the age in year and the range in mmHg. In general, we do consider a normal blood pressure from 90 to 135 over 55 to 90. We have oxygen saturation. This is an oxygen saturation probe that measures the oxygen level in your body. It determines the percentage of oxygen in the body by measuring the hemoglobin binding sites in the bloodstream that carries oxygen. And the normal oxygen saturation is 95 to 100% in room air. Pain. A more detailed discussion will be given for pain and pain management. For the purpose of vital signs assessment, the nurse will ask the level of pain that the patient feels using two major pain scales. Normally in adults, we use the numeric pain scale. Numeric pain scale is when you ask your patient, in a score of 0 to 10, 10 being the worst pain possible and 0 as no pain, how much would your pain be? Sometimes, if the patient couldn't comprehend a numeric pain scale, we do use a Wong-Baker's pain scale that says 0 for no hurt, 2 for hurts a little bit, 4 for hurts little bit more, 6 hurts even more, 8 hurts whole lot, and 10 hurts worst. Urine output. Normal urine output is calculated as 1 ml per kilogram per hour. In general, for adults, 30 to 50 ml per hour is considered adequate urine output. Patient not on indwelling catheter needs to void within 4 to 6 hours. Glasgow COMA scale. This is a Glasgow COMA scale measurement that measures best eye response, best verbal response, and best motor response. Normal GCS is 15, and that's the perfect GCS score. Below that needs constant monitoring. And GCS of 8 is normally for intubation, depending on the hospital policy.